that does not make them insignificant or unreal. You being with them in those challenges and understanding them makes a world of difference to the youth today. The most heartwarming part of my clinical practice in the clinics is when I see youth coming to my clinic, sometimes with their parents and sometimes just by themselves, to talk about their health. They are 19, 24. And it's so good to see them. They inspire me because when I was 24, I didn't seek anything. I didn't seek medical care until I started having children. I was forced to see healthcare. I didn't prepare myself for the mental health challenges that I didn't know I was going to face or I was facing at the time. And I will continue to face as I have grown older. The wisdom of that these are going to be part of your life has dawned upon me. And the better you prepare yourself, better you prepare your tools to handle them, is going to be so beneficial to you and your families. The other thing that I have seen sometimes in families who have been refugees or immigrants is role reversal, where the children become the primary support and care for their parents. And that is from an early age, which is a lot of expectation. Yes, they can do it, but it does add challenges. It does make their journey harder. And you understanding that part, you having awareness of that part is very important to make that journey easy and tolerable. Now, what I would like to say that in many cultures, powering through struggles and trauma, mental health challenges is thought as a virtue. You can say that yeah, it makes you stronger. And yes, indeed, it does make you stronger, but that's only half truth. The other part of it is that you do not have to do it alone. You do not have to do it without tools and unequipped. And you do not have to suffer through it every single time. So come, seek the help that you need. Encourage your children to do what they need to do to take care of their mental health, physical health, and to be best version of themselves. To the youth, I would like to say that please remember that taking care of your mental health is not selfish. It is an essential part of your journey to become the best version of yourself. You are unique. Your ability to adapt, your ability to understand different perspectives is unique. And you can do that. Mental health is as healthy as your physical health. As we go over the course of this event, our agenda is replete with inspiring stories, thought-provoking discussions, and actionable insights. We have distinguished moderators, panel discussions, and a stellar lineup of speakers who will enlighten us on various aspects of mental health challenges in immigrant and refugee families. We will also have the privilege to hear the real stories of having journeyed from refugee camps to medical schools here in US. Let this conference be a place where you gain insights, tools, and inspiration to navigate life's challenges while preserving your mental health. I would like to encourage that as you dive into discussions, stories, and experiences, please just not listen, but participate and reflect to see how you can apply those things to your own life. Lastly, I would like to say thank you to Sudarshan, the team, and the organizers to put together this event. Thank you so much, and please enjoy the conference.
Thank you so much, Dr. Seigel, for such an inspiring speech. Now I'd like to invite on stage Leela Chamlagai. He's a second-year PhD student at Brown University for a mental health crisis presentation.
Thank you, Kamala. My name is Leela, and I'm a second-year PhD student at Brown University School of Public Health. And today's my presentation is about the community empowerment and mental health service delivery via task shifting approach. So I want to begin and think you for a second with this scenario. Two young men, Mr. Ram and Mr. Shyam, living in the same background with a similar occupation, end up with a local emergency hospital complaining of the acute chest pain. Mr. Ram is sent back to the home, but Mr. Sam is offered with a cardiac procedure. What might have you noticed in a difference of these two identical men who is living in the same background? Mr. Ram is diagnosed with a mental illness, but Mr. Sam is not. Difference in the quality of the treatment received by the people who have a mental is one of the reasons why people live in a shorter life with compared to the population who does not have a mental illness. Obviously, mental illness can kill the people in a more direct way, and the obvious example is suicide. So when we are talking about the suicide, you might get surprised, many of you, so do I, when I first came to know that suicide is one of the leading causes of the death among the youth, including the refugee population in the US and low middle income country. And when we are talking about the suicide, in particular in our community, we shouldn't forget about the journey that we begin all the way from Bhutan, refugee camp, and also in the US. I was born and grew up in a Bhutan, in a refugee camp in Nepal, and as like many of the population, my family is so evicted from Bhutan in early 1990s because of the Bhutanization that has government of Bhutan culturally targeted for the religious and eliminated the citizen right, and also many were forced to leave the Bhutan and end up with mostly in Nepal. And we lived more than 20 years in a refugee camp in Nepal and settled in the eastern part of Nepal. So except many violence, experiences further violence, and also difficulties in education, unemployment, discrimination, food ration provided by the UNHCR was obviously not enough for 2 weeks, and also natural disaster, flood or other has continuously engulfed the childhood of the youth population in a refugee camp also. And third country resettlement began after in 2007, and according to this, US Embassy of 2016, more than 100,000 population has resettled in the US. So early in 2007 and 2008, when 2013 and 14 has this spiraling rate of the suicide in the US, the CDC has conducted the research and said that suicide rate among the Bhutanese population has 24.4 per 100,000, with compared to the national average suicide rate, which is 12.4. And I want to pause here and make you to think, in the statistical point of view, what does that reflect when we are talking about the national suicide rate is 12.4 and the suicide rate among the Bhutanese population only is 24.4 per 100,000. The data shows that the suicide rate among our population is double than average suicide rate with compared to the national average suicide rate itself. So, and it's because I wouldn't be surprised that many of us has experiences the trauma in Bhutan, right, and in refugee camp, and that leads to the other unemployment in US, language barrier, cultural barriers, cultural shock are some of the overlapping causes of the mental illness in the US among the resettled Bhutanese population. So let's compare this data. As I said, suicide rate among the resettled Bhutanese population is 24.4 per 100,000, and the suicide rate among the resettled Burmese population is approximately 9.4. And this means, with compared to the suicide rate of the South Asian refugee population in the US, the resettled Bhutanese population has almost 3 times with compared to the other refugee population in the US only. So what percentage of the stress, anxiety, and depression is also leading to the mental illness and the suicide in our population? And this leads to the another staggering data that depression only is 21%, and symptom of anxiety is 19%, and post-traumatic disorder is 4.5. And I want you to notice this, that this was conducted early in 2015, and the data is more and more increasing, and the suicide rate is also rapidly increasing as the community is more and more settling. So then we end up with this socio-ecological model in a public health framework. And factors associated with the mental illness are obviously demographic factor associated with the depression, and the data shows that inability to read, write, mass awareness about the mental illness, lack of awareness, in fact, are one of the causes. With compared, is almost double with compared to the other population who does not read, write, and have a mental awareness about this all stuff. Also, hidden story of this stigma, sorrow, shame, guilty, and negative connotation associated with the mental is one of the reasons why population in our community has a high rate of mental illness with compared to other population. And post-migration difficulties associated with the suicide. As we are talking about this triple trauma paradigm, the mental illness was already, to some extent, was in Bhutan, because our population has eyewitness or witnessed this life-disturbing event in Bhutan, and that trauma has overlapped in a camp. And when we came here in the US, that is also overlapped. So it's called triple trauma paradigm, which also leading the suicide rate in the US. And from the socio-ecological model, we can say that suicide is not only because of the individual perceives, right? It can be also connected with the structural level and the policy level as well. So from the individual level, cumulative wound, which is from the Bhutan to Nepal in a refugee camp to the US, and from family relationship has also played a vital role. Back in Nepal, as we have a family who has this more powerful people are more likely to go to the job and then conduct this family household, whereas in the US, youth are more likely to take over those job, and then population, the senior population feel less disempowered as well. And the community has the suicide yet, but they are unable to openly conduct that. And from the societal level, that is the structural level also. And this socio-ecological model was conducted by Dr. Rochelle Frauenfelder and her team in the Harvard University and Boston College. Now, how can we address this issue? So let me talk in the more basic level. I don't want to talk here from the specific about the intervention itself, but how can we make the general intervention? And obviously the task shifting idea come here. The idea of task shifting is very simple. It is when there is a shortage of mental health care and the lack of the other issues, right? And then there is a high rate of the mental health illness, then we need to shift this idea from the mental health expert to the ordinary normal people who are available in the community, and that transfer those knowledge and make sure that these youth are conducting very effective intervention, and most importantly, take the ownership of that issue and act upon it. So that is a basic simple idea of this task shifting. And Dr. Bikram Patel at Harvard University School of Public Health and team has acronymed this very simple term, Sundar. So what does it mean? So Sundar means, first of all, we need to simplify the message. If we want to create a mass awareness about the mental health illness, we need to get rid of this unnecessary jargon that medicine has invented by itself. Unpack the complex medical health intervention into the smaller and more easily it can be transferable to the trained individual. In our case, it is for the youth of the community. Deliver the intervention to the people where they are, not into the larger institution. In fact, we need to collaborate with the community-based organization and design the intervention that is culturally tailored toward the own community itself. And we need to deliver the mental health care or intervention, whoever is available and affordable in the local community. And lastly, we need to reallocate the few specialists to build the capacity and then deliver that effectively. So even though the task shifting is very more likely promising in the global and mental health aspect, but also it is very, very important in our community as well. And why is that? Because task shifting empowers the ordinary people from the community. By doing so, it can take care of the health population and their own community. And also, for me, task shifting is the true democratization of the medical power and so the medical knowledge. By doing so, it is for the people of the community, to the people of the community, and for the people of the community. So in this regard, we can advocate and empower more to the youth. At conclusion, mental illness is nothing to be ashamed of. It is more of the medical problem, just like heart or like diabetes. And most importantly, it can be treatable and curable. But we need to conduct and openly participate and talk more about the mental health illness in this type of platform. And also, we need to get rid of this hidden suffering stigma as well. Furthermore, the parents who are youths, parents need to be openly and discuss about these issues to the youth, and also youth also need to more openly discuss to the parents. At the end, person with a mental illness have a right to dignity and right to live with the similar like the other normal people. So at the end, dare to care for them. Thank you.
Thank you so much, Leela Dai, for that wonderful presentation. Now I'd like to set the floor for a Q&A session. So if you have any questions for Leela Dai here, please ask away, raise your hand, and I'll come to you. Thank you.
Hello, I'm Davion Green Tucker. Nice to meet you. My question is, so what do you think is the best way for parents to go about speaking about this? Is it like setting a specific day aside? Is it like a once a month thing? Like, how do you check up and talk to your kids about that?
So I think one of the best way for the parents to talk about is we need to make sure first mental illness is nothing to be ashamed of, right? We need to educate them obviously that it can be treatable and it can be curable. And there is this idea of, again, like, believe that once we are diagnosed with a mental illness, it can be there forever, and it is absolutely not true. It can be treatable and it can be curable in a long way. So that we need to make sure that the parents are knowing and openly talk about that one.
Okay, any other questions?
Sorry about that, I got another question. A lot of things that I find happen is like a lot of disconnect, like as far as like language, like how, you know, kids don't know how to use their words and really communicate how they feel to adults. What do you think is best for them to find that info or like kind of learn how to start to express themselves better so that their parents understand it? Because, you know, there's a big disconnect. I'm not sure if it's, it probably is culturally too, but yeah, period, there's a disconnect.
Well, that is a good question actually. Thank you. How can we start having a conversation about the mental illness among, and what is the appropriate languages that we can be used? Well, depend upon the culture, right? Actually, you're right. Culturally tailored, the term that we used, because especially in our community, when you're talking about the mental illness, there is a feeling of like crazy, right? One time they become a crazy, it can be a whole time or period of the over. So it depends upon what term would be a more comfortable, and that is even used by the community, and how can we slowly, first of all, we need to make that the environment is safe, and then comfort to talk with the parents. We need to create that environment, safe environment, and ensure slowly, we need to win the heart of the parents and make more closer. if there is a disconnected. I don't think it is a good idea to just go and jump into the mental health issue itself. We need to talk on the other broader issue and slowly go into the specific mental health issue. I think that is the best way, but it depends upon the culturally tailored as well. Any other question, please?
I have a very simple questions. As a suicide also falls in a mental illness, why we have more male suicide rate than the women in our community especially?
That is really a good question, and thank you for asking. As I said, our community is a male-dominant society, right? Back in Nepal, or even in Bhutan, the male who has a power in the house, right, or who take care of the family, or household member, used to take responsibility of the family, and that is one of the causes that a shift in the family or a shift in the traditional role is one of the reason that has a male society compared to the female. And when we came in the U.S., male, which not only male who is feeling less empowered or disempowered or a burden toward the society because the parents who take care of the family or household of the family are sitting idly in the home, right? And the children are taking care of them, and they feel that they are less empowered, and that feel a burden toward the society or a disempowerment leads to the mental illness, stress, anxiety, depression, slowly having high rate of suicide, and that is what the research has showed as well. Specifically when you're conducting the focus group discussion or the qualitative research.
Does the cell phone and social media have any impact on mental health, one? And my second question is, does religion, spirituality, faith have any impact on warding off mental health?
Well, the first part of the question about the smartphone or the electronic, actually, honestly, that is out of my specialist or like out of my research interest. But the research shows that there might be, because specifically, according to the research conducted by the Harvard University and then Brown University itself, shows that yes, which is called over-romanticizing of the social media, right? The youth, specifically when you're using the cell phone too much, they are more likely to have a idea of copying this over-romanticizing of the social media, means trying to exactly copy what their peers are doing from the social media, and does that, yes. To answer the second part, specifically religious spirituality does play a vital role in the mental health in a positive way. For example, specifically when you're talking about the residual potential population, just a few weeks ago, we had conducted this pre and post research about this impact of the mindfulness-based meditation, and that has shows that the stress and anxiety level has quite decreased with compared to the pre that has about the trauma and stress among the residual potential population, and that paper is coming soon as well. So yes, and to answer your question, that plays a vital role in the positive mental health improvement as well. Yes.
Okay, so I think we're going to end our Q&A session here. Thank you so much, Dai.
Thank you. Thank you so much.
So now I'd like to welcome Dr. Nipin Katel for our keynote speech. Please. Thank you.
Hello, everyone. Let me just fix this. Hi, everyone. So, first of all, I would like to express my heartfelt gratitude for inviting me to speak at this conference that's being organized by the Bhutanese community of Central Ohio. It is my tremendous honor and privilege to have this opportunity to address my own story of resilience as well as addressing this topic of mental health. My name is Nipen Katal, and I'm a family medicine physician at Mount Carmel Medical Group in New Albany. I have been working here since actually last month after I finished my residency earlier this year in June. But I'm going to talk about my story first here. So I came to the US in 2006 after living as a refugee for about 20 years in Nepal and India. We first came to New York City, lived there for about 6 months, and then we moved to Atlanta in 2007, where I spent the next 5 years. I completed my bachelor's degree in biological sciences in 2011, and then from Atlanta I moved to Pittsburgh in 2011, and then I was briefly working as a lab technician for about like 6 months, and then I decided on going to medical school. Obviously, I had to take the MCAT about 2 times before I got a decent enough score to apply for medical school. And I had to apply to medical school for 2 cycles as well because I was not successful on my first one. So finally, after finally I got accepted to medical school in 2015, but that was not the end of my journey. It was actually the start of a very long and a hard road ahead, because medical school was unlike any other course I had taken in my life. Their study days were easily like 12 plus hours, and then you have exams after exams, and each exam progressively gets more tougher and tougher. Medical school, they say, is like drinking water from a fire hydrant, and this was like actually really true. And then finally, with a lot of struggle but a lot of persistence and patience, and also support from friends and family members, obviously after passing all those 100 plus tough exams, and as well as 8-hour-long board exams, I completed medical school and became a doctor in 2020. Then came residency that started in 2020. Now you are actually seeing real patients, you are actually managing patients on your own, and the learning curve during residency is also very steep. Even in residency, I was briefly placed on a remediation plan for a few months, but this did not set me back. I successfully completed all the requirements that were needed in residency, and I also passed my family medicine board exam early this year, and today I'm a board certified family medicine physician. Thank you. I was actually inspired to become a doctor from my mother, who herself had wanted to become a doctor, but she was not able to. And she always had wanted her son to become a doctor, and I am proudly standing in front of you all, speaking as a family medicine doctor and making her dreams come true. And then when in 2008, when the Bhutanese refugees started immigrating to the US, that was when I got more motivated to become a medical doctor. I was then working as a Nepali medical interpreter, and I realized that there was a huge need for Nepali-speaking healthcare providers, and this motivated further to me to go to medical school and also help my community. To all my aspiring young Bhutanese, I would advise you to keep your dreams alive, keep working hard. Your road ahead will not be an easy one, it'll be full of obstacles, but as long as you have a clear plan for yourself, and you have a clear goal, you will be successful. Try to find mentors in the areas of your interest, ask for advice and support from friends and family members to support your ambitions. Please do not get swept away by the attraction of money. Please do not fear the word loans. Once you complete the program of your goals or your dreams, you will easily pay off that loan. We have lost so many young, brilliant, young Bhutanese who have been swept away for different kinds of reasons, be it money or be it some other issues. And also I would like to tell all my young Bhutanese that, who have a good family support, like for example, if both of your parents are working, if you have other family members who are working, take advantage of that, pursue your education and your dreams. Speaking of mental health, for which we are here today, mental health in the Nepalese society as well as in our Bhutanese community has always been shunned upon to talk about openly. The Bhutanese community has a unique and challenging journey after having gone through forced displacement and resettlement. The journey from Bhutan to Nepal and then to US and other parts of the world has been marked by adversity, loss, and adjustment, which can have lasting mental health implications. The most significant issue faced by the Bhutanese community is obviously the stigma that surrounds mental health, which can make it difficult for individuals to seek help and support when they need it the most. We should all work together to break these barriers and encourage open conversations and promote understanding and compassion. Mental health is an essential part of overall well-being, and seeking help should be seen as a sign of strength and not as a weakness. Access to mental health services is another concern. Language barriers, cultural differences, and lack of awareness about resources can make it challenging for members in the community to access the care that they need. As a community, we must work to ensure that all healthcare services are culturally sensitive and also linguistically accessible to all. There is a high number of undiagnosed depression, anxiety, bipolar, post-traumatic stress disorder in this community. Obviously, like discussed earlier, the Bhutanese community today has also the highest number of suicide rate seen among the immigrant population. In addition, we are also seeing newer mental health conditions in the youth because of high rates of addiction and alcoholism. As we adapt to this life in the new country, the pressures of acculturation, language barriers can add to the toll of our mental health. It's also important to make our non-Nepali speaking healthcare providers be aware that depression, anxiety, PTSD can manifest as psychosomatic symptoms, especially in the older Bhutanese patients who have a history of trauma and torture back in Bhutan. To address this issue, we must prioritize education and awareness. We need to engage community leaders and organizations to provide information about mental health, reduce stigma, and promote the importance of seeking help when needed. Further, we must advocate for increased access to mental health services tailored to the needs of the community. This includes offering services in Nepali or the native language and ensuring that our healthcare providers are culturally competent. Lastly, we must foster a sense of belonging and community support. During the times of crisis, having a strong network of friends and family, and also especially the community, can make a difference between life and death. So let us all work together to create a safe and supportive space for anyone who wants to share their experience of mental health and who can seek help without judgment. In conclusion, addressing the mental health challenges faced by the Bhutanese community requires our collective efforts. By raising awareness, promoting access to culturally sensitive services, and fostering a supportive community, we can help individuals within this community lead happier and healthier lives. Let us all move forward with compassion, understanding, and a commitment to mental health for all. Thank you.
Thank you so much, Dr. Katel. So now we're going to set the floor for any questions. We also encourage our Zoom participants for any questions. If you do have any questions, just ask away in the chat. Thank you.
Hi there. I don't know if you know, but there are a couple students in the room who are, aspiring to become physicians one day. And you were in a very unique situation where not only were you a refugee, but you were also a medical student. And I know that being a medical student comes with its own baggage. I know that burnout rates are high. So I kind of just wanted to ask you what your experience navigating mental health as a refugee and a medical student was.
Thanks for the question. That's definitely a good question. So, when I came to the U.S., I definitely, I had a clear plan laid out for how I would go through this. Obviously, the first step would be to get like undergrad degree, bachelor's degree in some kind. Typically you have to go through the pre-medical route, and then you it's preferably better to major in like biology or chemistry, obviously, and then the next step would be to getting the MCAT, and then you apply for medical school. So during medical school, it's important that you have a good social like support. So I was lucky enough because I was already married by then. I had my wife with me, so she was a great support for me. But obviously, if you have friends and family members, or like if you have your parents living with you, that would be that'll be a big help for you. And if in medical school, we almost all of us like usually have to take loans. So, but obviously you have to pay it back later on. Obviously, in medical school, when you are there, you are actually studying for 12 hours, more than 12 hours every day, and then you'll be studying for exams. So it's definitely stressful. For me personally, usually, when I was in medical school, I made sure that I was still working out. I was still having, enjoying my hobbies. Every other weekend, we would go to this town in close to my medical school in Knoxville, just to spend a few hours there. So that's how I made my way through medical school. Obviously, you still have to work and study and do all those things. So.
Any questions?
Thank you, Dr. Patel, for the talk. Really interesting. And I was wondering, in terms of access to mental health providers who speak one's native language here in Central Ohio, what is the landscape in terms of providers who can talk to patients in Nepali, or for other communities, Somali or other, Spanish-speaking large populations here? How easy or difficult is it to access mental health care in your own language?
So it is definitely very difficult. So a lot of the Nepali patients who come to me, they never ever have talked about depression or anxiety. I think, especially with the elderly patients, they're not able to describe how they feel, obviously. And then I think I kind of briefly talked, in the elderly population, depression, anxiety, those can manifest as somatic symptoms. So it's important to be aware for any provider that, in this population you can see different symptoms. It's not necessarily they'll not talk about being stressed, but they'll talk about, my hands and feet are burning. I just feel stomach pain. I have this vague, so if they're having those vague kind of symptoms, those could be signs that they have that probably is connected to undiagnosed depression, anxiety. And there also has been studies that was done back in I don't know the exact year, but 2000, maybe 1998, they did this study on torture victims who were victims of torture back in Bhutan, and they were having a lot of PTSD and those kind of things. So.
Any other questions?
Specifically in residency, how did you manage your mental health? Because I know, in residency, you have to work very long hours and stuff like that.
So yes, obviously, medical residency is definitely stressful. You're working 6 days, and easy 70+ hours. For me personally, I did not really seek counseling, which now that I think of it, I should have maybe sought counseling just to it's easy to just talk with someone. But obviously, like I said before, even during residency and also medical school, I was still working out. I would make sure I would go to the gym at least 2 to 3 times a week. And sometimes I still made time for fun, watching a movie, going out with your family members to explore different restaurants. I personally enjoy photography. I also play guitar as a hobby, and I was, I like singing, doing different covers. So I was still making time for my hobbies. That's how I was managing my mental health, I would say.
Also, I was wondering if there were like any fears within like the medical community that if you voice your concerns about mental health when you have your medical degree or license that you'll get it like revoked or anything like that.
Yes, there is that fear, but if you, it kind of depends on everyone's different, right? So if your mental health is really like, if you're feeling really stressful, if you're really feeling overwhelmed, then obviously you should definitely talk about it with someone. Like in our program, we had a behavioral specialist, so we would, if you're feeling stressed out, we would go with it, talk to her, and she would then tell you what exactly to do. But yeah, so we had that help with us. And also there are programs when, in the Mount Carmel system itself, if you're feeling anxious, depressed, or if you have any kind of medical or mental health issues, I think you can talk to a counselor, and they're gonna keep all the information private. So there's that option as well.
Okay, I think we have one Zoom question. Okay, Kagi wants to ask, how can you approach the topic of mental health to our parents who don't understand the importance or the consequences of certain GAD? Also, I find it difficult to speak in Nepali regarding mental health to my parents.
Okay. Could you repeat the question? You kind of said GED in between.
Yeah. How can we approach the topic of mental health to our parents who don't understand the importance or the consequences of certain GAD?
Did you say GAD? Oh, general. Okay, sorry. I was. Well, that's a good question. So usually, if you're taking your parents to see a doctor, and if they're always like accompanying the parents, I would definitely tell them to continue seeing the doctor like they have scheduled, and obviously I also it's I would probably tell them if they're showing some kind of symptoms, like I told earlier, if they're showing any physical symptoms, this could be possible depression, anxiety, and maybe they could try medications as well, but you can tell them hey, this medicine is for something else, not for depression and anxiety. I would try doing that route first, and obviously try to try to be patient and just keep on trying it until they are agreeable to start a medication.
Okay, thank you. I think that is all for our Q&A.
Thank you.
Do you have a question? Okay, one last question, guys.
Thank you so much, Doctor. Quick question would be not only for Nepali speaking Buddhist community, all different communities, youth after they're 18 and above, right? So due to so many reasons, probably they're out of home, or even with parents, probably they don't have health insurance and good support, and probably they don't get work, right? So they don't have health insurance. So is there any organizations or hospitals who can support to those kinds of youths who are going with mental illness, but they don't have medical insurance and anything? Any informations where they can contact?
So typically when I was in residency, our clinic, if patient did not have any insurance, our social worker would try to get connected with resources that would see patients for free, or patients who had no insurance. I think Ohio State might have some clinics that might take uninsured patients. I think Dr. Cycle might know more than that, but I have had patients get connected to clinics that would take patients who have no insurances. So I think there's a question there.
I think we're gonna end our Q&A actually. Sorry. But we do have someone here that would like to tell you something.
Hi, I'm Dr. K, Alcohol, Drug, and Mental Health Board of Franklin County. I'm on a panel later, but since this question came up, I want to make sure everybody knows that these booklets that are sitting on the Adam H table, these are all of our network providers who serve in behavioral health services, so mental illness and addiction, or drug and alcohol. All of our services through these organizations are offered for those in the community. Anyone who is either underinsured or you have no insurance at all, you will not be turned away.
Good to know.
Thank you so much. Now we will hold our Youth Lived Experiences panel, and this panel will be moderated by Dilasa Adhikari.
Hi, everyone. Can you hear me? Okay. My name is Dilasa Adhikari. I'm a third-year student at The Ohio State University. I'm not going to go into my bio too much. I'm sure it's in the panel somewhere. Not that there's much there, but that's a work in progress. I am going to be moderating the Youth with Lived Experiences panel, and with me I have three very bright panelists, each with various refugee and immigrant backgrounds, all who are going to be sharing very raw and unfiltered experiences navigating their mental health. And so I encourage you to listen and hear what they have to say, and I also hope that you draw some inspiration from these really courageous ladies. But without further ado, let's get started. Start with my first question. Just gonna have you guys introduce yourselves and share your background as a refugee or immigrant.
Hi everyone, my name is Nisha Lorali, and I came to the US when I was 3, and I don't really remember much because I was young. We came to Texas, and then we moved on to come here in Ohio after 2 years.
Hello, my name is Maraf. I have a bit of a different background to everyone here. I'm a refugee too, but from Kenya, and I moved here when I was 7 years old, so I do have a significant portion of my identity tied to being a Kenyan refugee, and I remember a lot of it, so I'll probably be covering that.
Hi everyone, my name is Regina Loaiza, and my family and I are originally from Peru, and I came when I was 9 months old, so also don't remember, but I was like very much involved in like my parents' immigration like journey and like getting citizenship and all of that, so yeah.
Thank you guys. Let's start by talking about how your cultural background and upbringing has affected your understanding and experiences of mental health. And this can be, you know, where there's specific cultural or societal stigmas related to mental health that you've encountered within your community, or and just how that has impacted you overall.
For me, I don't even think I knew what mental health was until like later in middle school, and even then it was still like a foreign concept to me. It was only in high school that it really got brought up because we had counselors, but because it was such a hush-hush like subject, we didn't really talk about it much, and I had like a really low like knowledge on it.
Yeah, sure, I can go next. I don't know if this is something that many of you can relate to, but being the first daughter in an immigrant household comes with a whole set of responsibilities, sometimes having to be like the third parent or just like orienting your younger siblings on like how to get things done, but also being like the experimental child, I guess, for your parents, and trying to like, as they're trying to figure out like how to fit in like America, you also are, and like also not knowing English and like having to translate documents for them, or also feeling like I have to be the best because I'm like not only representing myself but my family, and I have to make like their efforts to come here worth it. And so that for me gave me a lot of performance anxiety, just like getting all A's and like feeling like I have to be the best at everything. And so that definitely shaped like my own anxieties growing up, and yeah.
I really couldn't have said it better than they did. The imposter syndrome is very strong with my demographic of people. Since I came when I was 7 years old, I didn't have that many expectations, especially because we came through, I believe the organization is IMO, the immigrant organization that's in charge of moving the refugees to the United States. So they were very involved in our process and helping us fill out all the paperwork that was necessary. Financially, they were very involved. We had a little bit of assistance when we first came here, since finding a job would have been difficult, and they were aware of that. But besides that, it was just more about trying to find yourself and find your clique, I guess, in elementary school or middle school. And all of that kind of took away from your ability to be in touch with yourself. So as well as, for me, it was also a very similar experience with mental health, where I wasn't aware of the situation or the conversation around it until high school. And even in high school, it was a very vague kind of like passive mention of it, until I started experiencing situations regarding mental health, and then I was kind of just forced to face the music.
I think that I skipped a question here. Kind of going back to when you guys were introducing yourselves, how has your status as, being labeled as a refugee or immigrant impacted your mental health, or someone who comes from a family of that background?
I don't mind getting us started for this one. I think, I grew up in a predominantly immigrant community. I went to middle school and elementary school in Linden, if you guys are familiar with that area. And then my high school, which I'm just now realizing we all went to the same one, was also predominantly immigrant, and there was also a lot of other Latino students. And so I think for me, it was I was constantly comparing myself to others in their journeys, and thinking am I the model immigrant, or am I doing enough, or am I actually how am I demonstrating my roots and making sure that I'm grateful to my parents for everything they've done, but also persevering and not just being seen as another immigrant.
I definitely agree with most of the things that you said, except for me, when we first came to America, I was in Dayton, and that isn't as immigrantly rich as it is, as Columbus is. So the school that I went to was very private and very Catholic. So if you could imagine the demographic, it was white, and then you could count the POC with one hand. Which meant that I was trying to fit in, which means that I had to leave behind some of my cultural roots and assimilate. But then we moved to Columbus, and there is a much larger, I'm Ethiopian, by the way, I didn't mention that. There's a much larger Ethiopian community in Columbus, which means that I was exposed to that culture, but since I had already assimilated a little bit, since I was in Dayton for 3, 4, maybe 5 years, so it was a process of finding my identity again, and trying to fit in here, because there is also a bit of isolation within your own immigrant community if you're not fully enveloped in it. So if you don't know all of the cultural trends, if you don't know all the music, all of the, if you're not as spiritually involved as everyone else is, which I wasn't, because that's not the people that I was exposed to when I first came to the United States, it was a little hard, and I'm still trying to find that, because I also wasn't born in Ethiopia. A lot of the immigrants in Columbus were born in Ethiopia, especially the teenagers, so they're a lot more connected to their roots than I am. I was born in Kenya, and that's where I was raised, so my identity is kind of really all over the place. It's interlocked with Kenya, Ethiopia, and America. So I would say that my status has impacted me in just making me way more introspective, so that I could try to find my identity.
Yeah, for me, it wasn't really talked about much because everyone was of similar demographics, or as children, you don't really think of yourself as oh, I'm of this culture or that culture. You're just there with your friends. So it was only until later on that I actually started thinking about it. But as of now, it was being more American. I didn't want to be different. I want to be like everyone else. So I wasn't thought of differently. but now it's like more embracing your culture, hanging out with people and your family more, because like now you're like, you want to be a part of your community.
Thank you, guys. I think I also very much related on that. Especially what you mentioned about, feeling like you're not too much part of one community. It's more so like you're trying to find pieces and roots and bridge that into creating your own identity. I think that was a very important point. Moving on to the next question. What challenges have you faced in assessing mental health services or support systems, particularly as a refugee or immigrant youth?
For me, mental health was like kind of non-existent. So it was only to high school that we had high school counselors that I could go and talk to. Like for my parents, it was like we didn't really talk much about mental health. So like I couldn't go to them because I was like, oh yeah, they're probably not feeling the same thing I'm feeling because they don't talk about it. And no one really talked about it. So I was like, yeah, no one else is feeling this way until like high school. Like my friends are talking about it. I'm like, okay, so this is a thing we all feel. So it was like until later on in life that I actually talked about mental health.
Yeah, I also relate to that. Like, I think especially like growing up and feeling like you had to be the best at everything, like got really good at just like shoving everything inside and not really addressing it until like I had a sort of like traumatic experience in middle school that kind of forced me to like realize like, oh, like I don't feel great right now, or like I actually would rather just like hide in my room and like not talk to anyone. And so I think like for the first few years of high school, I just felt really alone, and would also just like, because what I knew what to do is like shove everything inside, I just kept doing that until like I had like started having like panic attacks and like having like nervous breakdowns, and I think that's when I realized like, okay, I can't really keep going like this, like I need to find help. And then right around that time, like the COVID pandemic happened, and like I think therapy became more accessible. And then it was actually surprisingly my mom who was like, oh, like I've been seeing this person, like maybe you should too. And I was like, okay, yeah, like whatever. And so then that's when I started like learning more about like what anxiety was and also depression. And so I was kind of lucky in that sense that I was able to like find that starting in my senior year of high school. But from the beginning, like most of my life, it was very much hush hush.
I really resonate with what you said about how mental health, the conversation only starts once people get to a state of like breaking point or distress, which makes the conversation around mental health more about mental illness rather than mental wellness. And I think that's just something that's not talked about enough. For me, regarding the question, I'd say that I was first exposed to just conversation around mental health with my friends when they started experiencing like mental health issues, since I wasn't really, I think the speaker from Brown, was it Leela? Yes, mentioned something about, it was that, okay, I don't remember, but something that he said resonated with me, in that mental health is just not talked about enough until you're at a point of distress. But for me, since it was my friends who first reached it and I wasn't really aware of issues that you could have with mental health, I started questioning about what it was, trying to learn more about it, and that kind of led me down a path of like finding counselors with my school. But the counselors weren't really focused on mental well-being. They were focused on helping the students so that they could get good grades. That was kind of the focus. So most of the time when students were seeing the counselor, they were just going because they weren't getting the best grades, and it might have had something to do with their mental health. And I think that's just a really, it's potentially toxic way to approach the situation. But another thing is that my parents were also incredibly unaware of the situation. They don't think of mental health as a topic, but I wouldn't say they're completely unaware of it, because I know that they're aware of mental illness, but for them it's a lot more mystic, I guess, since they don't see it as like an illness or like a disease, like Dr. Cattell talked about. They see it as more of a mystic thing of like something taking over you. And yeah, that was just my experience.
No, sorry, I just wanted to jump in. Like, I totally get that, and I feel like growing up too, you'll be like hearing stories of like, oh, your grandma had like depression, and like, look how everything turned out badly for her, or like, oh, this is your aunt, and like, she's seen as like a crazy. And I think also like growing up and hearing those stories, you're like, oh, well, I don't want to be like that, or like trying, and that also kind of like reinforces the thoughts of like wanting to keep everything inside, or like not having those conversations with family members.
Absolutely, it's a very mystified subject.
So this kind of ties into that as well. How have language barriers, financial constraints, or lack of awareness about available services affected your mental health journey? I know you mentioned, being in school and the counselor is not necessarily like accommodating to what you needed. It was more so a push to get better grades. Anything along those lines?
For me, I had to come up with my own coping mechanisms since I thought I couldn't go to anyone for help. So I would like be myself in my room, maybe either ignore it and push past it, or try to like embrace it, but that was always difficult, so I always pushed past it. And because of language barriers, like when speaking to like your parents or like your grandparents, it's like my Nepali wasn't really that good. It's getting better, but like it was hard talking to them. So like I didn't talk to them. And with getting like counselors and like therapy and stuff, that wasn't really brought up. It was more like, yeah, don't go to them, because if you talk about them, then your family know, and then if your family knows, everybody knows. It was more of that, like it was like spread everywhere, so you weren't just talking to your mom, you were talking to the world at that point.
With my experience, I'd say that I was first exposed to counseling after like a medical situation that I had, and that was like more focused on mental health, because it was that the medical situation was so bad that it was just like everyone who goes through this is I think legally supposed to have a therapist. So but when I did get the therapist, the barrier came with my mom not liking the fact that I was talking about mental health, because with her, the conversation of mental health only comes up whenever you've reached a point of distress, and she just didn't see that in me. So she thought that by me talking to these people, I was being convinced that I had an issue, and that kind of created a barrier between my mother and I. And my therapist also kind of didn't understand that, so all of the information that she gave me, or all the coping mechanisms that I learned, were pushing me even further away from my mother, which like also affected my mental health negatively. So it was kind of just a negative feedback. Yeah, it was a bad cycle that I was getting myself into. I'm sorry, could I ask you to repeat the question? Yes. So the language barriers wasn't as big of an issue for me. I know that with my parents it was, because we are so separated from the topic of mental health that we don't even have words for certain things when it comes to mental health or the conversation. But I think that my English was okay enough to talk about it with my therapist. The issue only came with cultural barriers, because even if there aren't language barriers, there's just a cultural competency discrepancy that exists with health care, mental health care, when it comes to immigrants, and that kind of caused me to shy away from it, especially the fact that I was exposed to counseling and just like talk therapy through school counselors, which were like, you always had a negative experience with, not always, but a lot of my friends had negative experience with the school counselors, so I was just from the get-go pushed off by it.
No, yeah, I 100% echo the cultural competency piece, because I remember one of my few sessions I would be talking about like stressful encounters with my parents, and they'll be like, well, why don't you just talk to them about it? And I'm like, girl, I wish I could, but it's not that easy. But for me, I think first on the cultural aspect, I think like I would talk about like my cultural upbringing and like my childhood, and like when I would start like learning about like things like, oh, like the fact that you had to sort of be the third parent, like that's not normal, and it's also like not fair for you to have that stress. So once I started like learning about these things that kind of like turned me into the person I am, I would try to have conversations with my parents and be like, hey, listen, like I'm not blaming you, but I'm also letting you know like these kinds of things that you and I did when we were younger, like have kind of made me more stressed out as an adult. And then they would just immediately shut down and be like, oh, why are you blaming me? Like I did the best I could with what I had. And I'm like, yes, but like I think with the conversation that was being said at the very beginning of like, we're not blaming parents, we're just trying to like start that conversation so that we don't keep having that pattern. Especially as like I have younger siblings and I would hate to see them like have the same stressors that I did. So I think with that, there's always an awkward conversation because you sometimes have to try to have these conversations with parents and like they just are kind of shut down and like don't want to have the conversation. And then in terms of the financial aspect, if you are like under 24, I didn't know this, but you can have like pretty much free psychology or like services from Nationwide Children's, especially if you're a student like me and you have like zero income. So I was able to continuously do that, but then of course like I ended up aging out. And so since then it's been like really difficult to like find another provider that like offers like affordable like therapy services. Especially because of the fact that it's so hush-hush, like I really did not want to ask my parents for any help or like be like, hey, like can I have $50 for a therapy session this month? Like I think just growing up like not wanting to be a burden at all, like that's also just like played into like trying to find good and affordable therapy growing up. So I still haven't found one, but we're figuring it out.
Thank you so much, Regina, for dropping that resource. Guys, use it or tell anyone you know about it. I think it's really important. We kind of touched on this a little bit with you guys talking about, you know, first kind of arriving in the States and getting like climatized to the environment, but maybe there's another piece in here. How has the process of acculturation and navigating multiple identities impacted your mental well-being?
I felt a sense of not belonging in anywhere, and like that, it's like I resonated with everyone, like I could relate with everyone, but then at the same time, who did I belong with? If I was with everyone, I was kind of with like, you know, no one. So I was like kind of lost for so many years until like high school. I'm like, yeah, this is me. And being a refugee and an immigrant is not just my full identity. Because I feel like a lot of people is like, yeah, I was from here, I had all this stuff happen to me. It's like, this is me, and like they can't have like any other identity because people only see them as that. But as you grow older, it's like you build your own like person. You build your own identity. You build your own picture, and then you could talk to other people about it. And like if they're giving you hate or anything, it's like, you know, this is also me. I'm not just this one thing. Yeah.
I think that I actually have more positive things to say about my acculturation experience, because even if I didn't get assimilated through my time going to a very private Christian school at a very young age, I think that coming to Columbus, if it played out this way, if I had come to Columbus immediately, I still wouldn't have been able to fully resonate with the Ethiopian community here because I was born in a Kenyan refugee camp, which means that like a lot of the people who were in that refugee camp were from all over Africa. And East Africa mainly, but they were from all over Africa, so no one really we found identity through the diversity that we had there. And I think I carried that over with me to the United States and was just able to find identity in all of my intersectionality with every identity that I was exposed to. So with a lot of my friends now at OSU are Nepali, and even with them, we're always talking about how our experiences with like American traditions or American cultures, how we feel about them, complaining a lot, and we find a lot of the similar things to complain about. And I think that gives me a sense of community. And then I'm also able to relate to like West Africans. I'm able to relate to first generation European immigrants through some of the like programs that I have that I'm exposed to. And so I think that my growing up in a really diverse place in Africa, which, because of the refugee camp I did, helped me kind of have a better experience in the US with assimilation and acculturation.
Yeah, for me, it was similar to what Nisha mentioned at the very beginning. Like, because I was surrounded by so many immigrants, but I was Peruvian and the majority were like Mexican or Salvadorian, so I still felt really like left out, because they would talk about like, oh, like, we do this for the holidays, and I'm like, oh, well, we do that. We don't do that. Or like, for example, like quinceañeras, like, yeah, we do that in Peru, but like not like that. Like, we don't do like the big celebration. And so I kind of felt isolated and like, oh, well, I mean, we have like similar backgrounds, just like being immigrants, but like we are also not the same. And so I find myself like comparing myself like, oh, like, if I don't speak Spanish the best, am I Latina enough? If I don't dance the best, like, am I immigrant enough? Or like, if I don't know all the different like traditions or like dance styles or the history. So I think it was hard just like growing up and like comparing yourselves and like seeing like, oh, am I enough for like whatever ethnic background you have? And even like coming to college and like meeting more Peruvians, like some of them had like traveled or like immigrated here at a later age, so they were able to speak more from like the Peruvian experience than I could. And then again, it was just like, oh, well, shoot, like I really want to connect to my culture, but like we are just not the same. So I think that was difficult too, but I think like even just having that community is also really helpful.
Thank you guys, it's been so insightful. We're gonna move on to our next question. If you are comfortable sharing this, could you discuss a moment that sticks out to you that has impacted your mental health, and kind of segue that into how you work towards healing from that?
For me, when I was like, it was back in Texas, our family got into like a car crash, and I don't remember much of it, but I do know it's kind of hard for me to differentiate what was real and what was a dream. But every time now, like, you know how you have that feeling where you're going too close to someone, but you're not touching them, but like it just glides through. It's like I get brought back to that moment. So with coping, I'm just like calm myself. Afterwards, I take myself away from the situation and like think about what happened.
Thank you for sharing that. Mine isn't as intense of an experience, but it was just a conversation I had with my mom early on in my high school career, if you could call it that. It was just, we were discussing, I forget what we were discussing, but it was on the topic of mental health. And there was a moment of realization that I had that kind of helped me see who my mom was and how she coped and all of the decisions that she made in her life. It kind of like all fell into place in that moment. And it was just that we were having a misunderstanding issue. And that came from the fact that she was also an emotionally traumatized person, and both of my parents were, from the time that they grew up back in Ethiopia to their process of moving to the United States, all of the betrayals that they faced, all of the war that they've seen, all of the graphic, horrible things that they've been through that I'm so grateful to have been shielded from so well by them. And so it just made me realize that this barrier that we have of just, she's, not to like put them on blast or anything, but they also are emotionally stunted, like to a degree. And they also need therapy to a degree. So some of the conversations that I'm able to have with other people that might understand me, I could not have with them. And I realized in this conversation that there's just no way, there's nothing that I could do to make my mother understand me. And that helped me see where she was coming from and all of the fears that she had, all the things that she warned me of. So now my experience with that helped me discuss with them better, communicate better, because now I know where they're coming from.
Yeah, for me, it was I guess like you could call it like a toxic relationship I had in middle school that kind of like ended towards the beginning of high school. And then for me, there was like, I didn't even, well, before I knew what gaslighting was, I was just like, oh, well, maybe it's my fault. Or I don't know, I think it also comes with just like being a woman or a girl back then, and like not knowing like what was normal and what wasn't. And that was really hard because I feel like that just like led into like a spiral of like blaming myself, and then just like not knowing how to cope with it at all because I felt like I was the only one. And then finding out that no, that's like really common among girls. And so it took me a while to cope with it, but I think just like realizing that like it wasn't my fault and that I came out stronger.
For a majority of the experiences you guys discussed, it kind of sounds like you had to reach kind of a breaking point before things started getting better, right? And I think that that's part of the reason why like introducing this subject is so important, like in advance, so that we can start recognizing the signs and getting to it before we reach a very like threshold, pretty critical moment. Because I mean, the way you go about navigating that in the end leaves a very big impact. With that being said, what coping mechanisms or strategies have helped you manage the stressors, and how can these be shared or promoted within the community?
For me, in the beginning, I was like, I don't want to think about it, I don't want to talk about it, I'm just gonna put it all in. But now I'm just like, I take myself away, I think about what I'm feeling, I let myself feel these things, and you should let yourself feel these things. Like, you can't just push it away because then it's gonna bubble up later and it's gonna be so much worse. So when you let yourself feel these things, you'll let it out, you'll understand yourself better and understand what's going on better as well. So just pull yourself away from the situation and figure things out.
For me, it wasn't as concrete as finding a coping mechanism. It was more just realizing what I was going through and realizing my emotion, and then being able to share that, whether it's just like informal complaint to like your friend group or anything, because it's really likely that your friends are going through the same thing or have experienced the same thing, and just being able to let it out or say it out loud makes a really big difference, and it allows you to kind of accept how you're feeling so that you could at least process it, because not saying it out loud or not accepting it, like it will build, or you will build resentment, and that will make it so much worse.
Yeah, similar. I also found that the best way I could cope through things was just like talking it out. Most often with like a psychologist, but I know other people like to journal or like draw it out, or just like, I don't even know, like make something, or like there's a lot of ways that you can like channel your emotions in a healthy way. But I think definitely, like you were saying, you have to like find a way to do it because you can't just let it build up. I think also like things that I discovered in therapy were like that I needed to do were like breathing exercises. Like I know some people will be like, breathe in for 4, hold it for 4, out for 4, or even like other things, or you'll be like, what are 5 things I see, 4 things I can touch, all those kinds of exercises that really help me, because I feel like when you're in that state of panic, you kind of forget where you are. So those kinds of grounding exercises were really helpful for me. But I think like overall coping mechanisms are like very personal. So if you, I'm sure you could like look it up and like just figure out what works for you.
So we're going to start to wrap it up. I'm going to ask one final question. What changes or improvements would you like to see in mental health support and awareness within the refugee and immigrant communities in the future?
I would like to see it talked about more. Like, everyone doesn't talk about it. Everyone's like, oh, you can't have this, like you can control it, but you really can't. But like talk about it more, have it be brought up. And also like in schools and other stuff, like even though like people like, I think kids my age and stuff, they're like, yeah, mental health is whatever, we don't want to talk about that, we don't want to beat it, but like keep pushing it, and then eventually like the message is getting through. It's, even if we don't seem like we're receiving it, the message is getting through. Just keep talking about it.
Yeah, and to just build on top of that, I think that education is lacking in the immigrant community, so I think just exposure to just the information or the conversation around mental health, kind of bringing the immigrant community up to speed with what the generations now have already been talking about, would be incredibly helpful. I know that with me, the biggest strides that I've made with my mental health was when I just informally was able to talk about it with my friend group, and just listen. Like, we would just listen. That was really enough. Just ask and then listen was enough to help bring us up to speed. So yeah, I think that education and exposure to the immigrant community.
Yeah, kind of building on what the two of you shared, I think as we know just from like our experiences, like mental health really starts really young, and like we had stressors because of school, but I'm sure that like a lot of other people like experience anxiety or stress at a much younger age. And so I think like building that as young as you can, like even when you're little, like if you're like having like a tantrum or something, like acknowledging that, and like also treating mental health like every other kind of health. Like if you were if your ankle was sprained for like a few weeks, you would go to a doctor, I assume. So if you're having issues with your mental health, like treat it just like you would any other kind of health. I think, and also just like validating and listening goes a long way, because as we've seen, like these things are normal, and like everyone goes through it. So as soon as we like normalize that and like make room to talk about it, like the better that we all can do.
And then to build even more on top of that, I think that there's also not enough information just circulating when it comes to mental health in the immigrant community. Like, I'm exposed to a lot of research articles just sent through my email because of what I'm like subscribed to. But a lot of the research articles and the journals that are coming out are always about mental health in regards to American teens or American adults, and never about people who have minority status in any way. So I think that pulling in demographics outside of our community also would be a big help, because we are living in America. We are kind of like supposed to try to inculcate, for lack of better words, ourselves into the American community. And I think that it would help if we had more attention from the community that we're trying to like group ourselves together with.
Yeah, and one more thing. I think like also like it's easy to say like, oh yeah, education, but I think also just like starting the conversation yourselves. Like I know we have a lot of parents here, or even just like adults, like ask yourself like, what are ways that mental health plays in my life? And like, how am I intentionally reaching out to my friends, my family members? How am I starting the conversation with my community so that like when future generations come, like it's not like a weird thing for them to bring up. So it really starts with us, with you.
Also on top of that, I think having mental health professionals who are experience the same things you experience or are from the same background will help a lot more, because they will know what you're going through. Like you said, your therapist said, why don't you just talk to your mother? Well, there's reasons. There's real reasons. And like if we had a person who was like understood where we're coming from, understood what we went through, had been through the same thing, they would like know how to help us better.
And that wraps up this segment. I would like to take a second to acknowledge and appreciate all our speakers today. Please join me in applauding. I do hope that one of the takeaways here is that sometimes it's as simple as having a conversation like this. I don't think anyone here knows each other too well, and yet look what came out of that, right? So I think one very applicable thing you can do is start having these conversations, whether it be friends, whether it be with family, whoever you feel comfortable doing it with. Thank you guys so much for the transparency. With that being said.
Thank you so much to the youth and Dilasa for this panel. We really needed this conversation. Now we would like to take a break to refresh ourselves and network. Please take refreshments and connect with one another. Also, while networking, please don't forget to give some attention to Shravan Chetri's art, our very talented recent photography graduate from The Ohio State University. We also have a Stick It to the Stigma wall where you can share your thoughts and feelings you had throughout our sessions today. Thank you.